Well, Janella, half of the country's COVID-19 deaths have been linked to long-term care homes and their vulnerable elderly residents. In Ontario, the Chief Medical Officer of Health today confirmed there are 98 outbreaks in long-term care homes and 145 deaths. Premier Doug Ford has called it the COVID-19 action plan that he announced today, and he released the government's enhanced measures.
We're mobilizing every available resource. We will stop at nothing to protect those who cannot protect themselves. Today, we're launching an all-out plan to fight COVID-19 in our long-term care homes. We will fortify the iron ring of protection around our long-term care residents and those who care for them.
So the government's new plan will have hospital SWAT teams go into high-risk homes and also offer enhanced infection control. The government is promising more screening and testing and protective equipment within 24 hours of a home's request. Workers will also be barred from taking shifts at more than one home, which has been a major cause of COVID-19 spreading from home to home. But the emergency order limiting staff to one home won't go into effect until next week and will only be in place for 2 weeks.
We've seen the warning signs. SARS was a warning sign. Advocates have been calling for years that massive changes need to be made, including workers only working in one long-term care home. Will you commit to taking a look at the entire long-term care system and overhauling it when all of this is done?
Well, I think we have to. And, you know, when these tragedies, and it's a tragedy that's been happening, not just here, but around the world, there's spots that you see there's cracks. And you've heard, I've come up here and been very public about some of the cracks and the holes in the system. This will give us an opportunity to fix a lot of things, not just long-term care. I think overall government, the way it runs.
Almost 500 long-term care staff have tested positive in this province. Now, they've had to work in more than one long-term care home because they aren't given full-time hours. Now, today's measures also do nothing to address workers in home care. There's nothing to stop them from going to multiple personal homes. One viewer emailed me to say her elderly mother is sent a different home care worker every day. So even if you take your family member who needs extra nursing help out of long-term care and keep them at home, the risk is exacerbated, something I addressed with the Premier and Minister of Health today.
Cynthia, when my mom was ill a couple of months ago, we saw the same thing. They're phenomenal people, by the way. These people that are taking care of people at home, we saw almost a different person every single day. And again, I'm going to leave that up to the medical professionals.
With home and community care, that's one of the things that we hear most from Ontarians about is the fact that when you have someone coming into a person's home to help their parent usually, and you're helping with things like bathing and dressing and so on, that's something where you really want to feel comfortable with the person that's coming in. You don't want a different person coming in every day. That is something that we have been working on, but we will continue to need to work on post-COVID-19.
As for testing, the province did 6,000 tests between Monday and Tuesday. The target was 8,000 a day by today, so the province is still falling short of its targets.